We're often asked why there sometimes can be quite a wait for routine appointments at our surgeries. So in this short video, I'd like to explain some of the reasons and the options we offer for your appointments here at the Alchester Medical Group. Of course, we understand that the length of a waiting time for an appointment is always very important to patients, but there are currently a number of reasons why, in some circumstances, the delay for a routine appointment may be of several weeks. First reason is that right now there's a real shortage of GPs all across the country. Fewer of us to care for our growing population's needs does naturally have a big effect on appointment waiting times everywhere. At the same time, people are living longer on average due to the fantastic achievements in medicine and treatments. That's great, of course, but it also means that more of our population is older, and older people often have quite complex chronic illnesses that understandably require more of a GP's time. As hospitals are very busy too, more of this chronic care treatment is now carried out by your local doctors than in the past, and your GPs are also required to perform far more screening and monitoring checks than in days gone by. This too can have an impact that can lengthen the waiting times for routine appointments. So what is there to consider about making your appointments to see your GP? It's important to remember that we have a variety of appointments. These range from urgent on-the-day ones to follow-up appointments and routine booked appointments. This helps us manage your treatment and appointment requirements. If you've an urgent problem that needs to be dealt with immediately, then please inform our patient coordinators who'll place you on our daily triage list to speak to our duty doctor, or they may offer an appointment at one of our health hubs with our emergency care practitioner, or offer advice where you can obtain this urgent help. Please give the patient coordinators as much information as possible, as this helps them to facilitate you to ensure that you get an appointment with the right person in the right time frame. We're listening to our patients and trying whatever we can to reduce our waiting times for routine appointments, as we know how important that is, but it is going to take some time. And sometimes a doctor may not always be the best person to see. At Alchester Medical Group, we've employed a physiotherapist, a clinical pharmacist and an emergency healthcare practitioner to complement our clinical team and help reduce waiting times by freeing up some of our GP appointments. Our patient coordinators are highly trained and often can advise you which person is the best to see. And if you've made an appointment and can't then attend, please do tell us you're cancelling. Because so many people don't tell us they've cancelled, we're finding that there's often around 150 missed appointments every month. If we could have fewer missed appointments, that would also really help to reduce some of the wait for routine appointments too.